Hi, I'm Dr. Riley, and I'm going to talk to you about plantar fasciitis. And plantar fasciitis is the plantar part of the foot, and it's talking about the fascia that's running from the heel to the ball of the foot. So when you have plantar fasciitis, it's the inflammation of that tendon that goes from the heel to the ball of the foot. The reason that it gets inflamed is because that tendon, as it's being stretched, so as your foot, as it starts to roll down, and if it's being stretched too far, then these fibers are starting to be pulled, and so that can cause pain in the ball of the foot or in the arch, but most commonly it's in the heel itself. And what can happen if you start pulling that tendon as it's pulling away from the heel bone, what the heel bone starts to do, it starts getting irritated, and so the body will react and start putting a spur down. Now, usually that spur does not cause the pain unless it's a spur that comes out and then goes up a little bit. So majority of time we're dealing with the plantar fascia that's inflamed because this arch, as it starts to flatten out, is pulling on it. So how we treat plantar fasciitis, the first thing that we do is we look at an arch support, like J1 INSOLES, that has support, and is going to support this arch so it doesn't continue to go beyond and flatten this foot out. The other things that we do for plantar fasciitis is we also have people take a rolling pin or a frozen water bottle and rolling it back and forth. So as you are rolling your foot on this will help massage some of that inflammation out of there. And it's also trying to help massage that tendon. And in effect, we're trying to get this tendon caught up with the rest of the foot since the foot has changed and flattened out some. Now, just because the arch is starting to flatten out doesn't mean you have flat feet. It still will depend on how much the foot flattens out, how much the foot rotates in this area, whether you need the arch supports that we provide for J1 INSOLES, either ones for flat feet or an average arch. The other things that we do for plantar fasciitis is that you have an inflammation now in the heel, and so we'll start with like an anti-inflammatory, such as Motrin or ibuprofen if you can. And the other thing we look at is cortisone shots. Now, cortisone shots are not fun, but they do help. And the reason that they're different than the ones for the pills is that when you have scar tissue, it's like a rolled up ball in the heel itself. And when you have that ball of scar tissue, it's so bound down that it cannot break up. And so what cortisone does, it goes in there and chemically breaks those bonds so that the scar tissue can break up, and now this tendon can get stretched out. So the treatments that we recommend are the arch supports from J1 INSOLES, the stretching, that I can show you how to do the stretching itself. And the most important thing with stretching is when you have, and you're using a wall stretch, that you want the foot totally straight. So you want to put a good stretch on this tendon to get a stretch on it. If you kind of tilt your foot a little bit, you're not getting a full stretch on that tendon itself. So stretching is very important. You can ice the area, sometimes cortisone shots, and very rarely surgery is needed for this. But if you've tried these things and it's still causing pain, then what you want to do is go see your podiatrist or your medical doctor to find out further what's going on. And we also have other information on our website at j1insoles.com or Facebook or Twitter or whatever.